Hello, everyone. Again, this is Dr. David, and tonight's webinar will be entitled "The Doctor is In." And I tell you, this is the more we do this, and we've been doing this now for about 4 years. The more we do this, the more excited I am about the opportunities and the benefits that are out there that most people don't have a clue about. And when it comes to health and wellness, when it comes to taking control of your life, I think it's important that people be exposed to the most information possible so that they can make the right choices about their health. And that's why we're so glad to be partnering with our CallMD Plus and bringing this presentation to you. Those of you who don't know us or have never heard about us, we are, well, Building Strength webinars. And like I said, we've been doing this now for about 4 years. And the goal has remained the same, to help people understand what really matters where health is concerned and why sometimes we lose our health. And two, with that foundation, with one as a foundation, we want to help point people to the most helpful resources that are out there. And that covers a wide range of topics. But believe it or not, I was shocked when I heard this. But the leading cause, one of the top 2 causes of personal bankruptcies in this country is due to medical bills, inability to pay medical bills maybe for yourself, your spouse, your kids, and that just throws people into chaos, financial ruin because of the outstanding medical costs they have to deal with. And that's why when I hear about opportunities and organizations like CallMD, and Mr. White is going to be going into detail about this, I'm excited to bring it to people's attention because I think people need to know about it. And I want to say a very special thank you to Dr. Daniel and Helen Sun, who actually brought this to my attention. And Daniel and Helen have been very close friends of mine for years now, and they've been great supporters of our vision and of our mission. And I just really love them dearly for all they do. So Daniel, Helen, thank you guys so much. I think you're out there. All right, that's our vision, folks. To help be recognized as a trusted resource for obtaining valuable and practical information regarding or related to health, strength, and human effectiveness. And we have had a lot of help in doing that. Okay. Just wanted to remind you folks that our webinars, the information that we share, are not to be used as a substitute for your expert, your physician's expert care and advice. Please take these presentations and the information here to take control of your health. And if you are on any long-term chronic treatment for any chronic diseases, please check with your doctor first before making any drastic changes. Very, very important. All right, Mr. White. Austin has a 32-year successful business career in sales, marketing, manufacturing, channel management, product development, sales training, and motivational speaking. He has solely owned 3 successful businesses and excelled in the corporate environment with Lithonia Lighting, a division of a Fortune 500 company, for over 8 years in all facets listed above. Austin ended that tenure as VP Sales and Marketing and Product Development of $156 million division of Lithonia's $2.0 billion annual revenue. He now serves as the Chief Operating Officer of CallMD Plus, which, in my opinion, is a revolutionary approach to medicine and medical practice. And with that, I'm just going to say, Mr. White, Austin, thank you so much for making the time to do this. And I'm handing this over to you.
Well, thank you, Dr. Dave. I clearly appreciate the kind words, and we certainly are very excited about the opportunity to present CallMD Plus. We're very excited about the movement that's moving forward into this country. We know that in this country, healthcare is an absolute chaos right now. It's not going to get better anytime soon. You can't utilize that word healthcare, if you will, in this country without eliciting significant response from your listeners. Let's talk about some of the issues in healthcare today and why it's important for us to kind of take control, as you mentioned earlier, of our own decisions within our healthcare. Healthcare industry today, it is broken and it's not likely to get better anytime soon, and there's a reason. First off, there are $2.5 trillion spent in the U.S. in healthcare alone this year. I don't know about most of the listeners here, but when I was growing up, trillion was a word that was never used. We hear this often now, and I think we're almost anesthetized by it, but it's a significant number. That's 2.5 with 16 zeros. That's a significant number. It's also about 20% of the gross domestic product. This is expected to grow to over $4.5 trillion in just 3 years. And these numbers are from the Kaiser Foundation, who's a data research specialist for the insurance industry, both to the insurance industry and to the government. Significant amount of money spent annually in this industry. There are three primary issues with healthcare. There's the cost of healthcare, the quality of the care that you receive, and the accessibility to quality care. Unfortunately, these elements are in direct competition with each other. And let me speak to that for a moment. By that, I mean simply, if you wish to control the cost of health care and keep it low, quality of health care is going to suffer and the accessibility to health care is going to be reduced. If you wish to give accessibility to everyone in the masses, cost of health care is going to skyrocket and the quality of the care is going to suffer. If we choose as a country to make sure that the quality of our care is the best available anywhere on the planet, the cost significantly goes up and accessibility continues to go down. These are huge issues, and what you have tugging and pulling at the core of these three issues are different fractions. You have the you have the insurance industry, you have the pharmaceutical industry, you have the AMA, you have hospitalization industry, you have now the government, and other various factions through this, all trying to tug and pull a piece of this industry. And whether you're for or against healthcare reform politically, please understand that it does need reforming, not necessarily the way that we're seeing it come about, but certainly the costs and challenges of ensuring and providing timely and quality care are going to continue in the future. These are not issues that are going away. Let's take a look real quick. When you or a family member are sick, what do you do? If you call your primary care physician, they can probably see you within 5 to 10 days. However, if you're sick, you need help now. And if you have insurance or don't have insurance, we're going to talk about that momentarily, but if you have insurance, you probably have a primary care physician. If you don't have insurance, you probably do not have a primary care physician, and you're probably going to wind up going to a walk-in clinic. You're going to sit for a few hours in a small room with more very ill people, and you're going to pay upwards of $125 for that visit. You're probably going to have a chance to visit with a nurse practitioner and then possibly an RN. You may or may not see a primary care physician if they're in there or not in the clinic at the time to receive your full diagnosis as you're coming through. Well, what if it's late at night or you're traveling out of town? What do you do then? When the clinics are closed, is it a trip to the nearest emergency room? What are your solutions here? I want to put together some current situations, and I show here the source of the information, and I'll walk through these and speak with them individually. First off, in the year 2000, the average annual health insurance cost, major medical, for a family of 4 was about $6,400 a year. Well, that cost in 2011 is over $15,000. That's an average of $1,256 a month. The average deductible at that time for a standard PPO policy with an 80/20 copay was around $400 or $500 for the family of 4. The average family deductible today is over $3,000. The U.S. average to wait to see a primary care physician today is 22 days. It's about 12 to 14 days here in Tampa. If you're in the Connecticut area, it's around 42 days. It's a significant issue. In the U.S., the average ER visit was over 4.5 hours. Now, that includes people that came in that were sick. It also includes people that came in with automobile accidents, strokes, car wrecks, and things of this thing. The average cost of an ER visit in 2010 was over $1,400. If it involved abdominal pain, that average cost was over $4,000. Almost 70% of emergency room visits today in this country are non-emergency in nature. I will share with you another number that we have, and those numbers are that over $116 billion were spent last year in emergency rooms. Over 70% of those did not need to be there. They had no other place to go. Those bills continue to crank up, and if someone comes in without insurance, the average tax-paying American winds up ultimately paying the bill either through your tax rate and your millage rate of your home or through increased insurance policies and premiums. The average cost of a walk-in clinic in 2010 was $110. We just got the information back that it was about $125 in 2011. And I believe, as Dr. David mentioned earlier, this is a very sobering statistic, and this is actually a slight bit short now. It says about half. It's actually filings in the United States are due to medical expenses and the inability to pay them. With health insurance, basically you fit into two categories in this country. You have insurance or you don't have insurance. If you have insurance, you have some coverage for you and your family, and there's a monthly premium based upon multiple criteria that you must pass: age, health, gender, past health issues, etc. You will have an annual deductible, which is cash out of pocket, and you're somewhat protected. And we believe clearly that you need insurance. You need catastrophic insurance without question. You do not need to be without some insurance. If you don't have insurance, you have no coverage for you and your family. Well, you don't have a monthly premium, but you don't have any coverage. There's no deductible, but you also must pay cash for all medical services rendered. You're somewhat vulnerable. I would say very vulnerable. Affordable health care for everyone in the U.S. Well, current estimates that over 50 million Americans not covered by any form of health insurance. That number doesn't include the underinsured or the partially insured. That's just the folks that have no form of health insurance. Again, these numbers are likely short due to many elements. The real number of people that are underinsured, other factors, self-employed, those that actually do have health insurance, you're paying higher and higher premiums every year, and you typically have high deductibles to meet annually. I want to share with you another number here that's kind of sobering. We talk to a lot of health insurance associates and agents and the Kaiser Foundation. A couple of things that they anticipate happening here in the future. Kaiser Foundation, along with Money Magazine, stated that in the next 2 years, it is anticipated that over 30% of all U.S. corporations, not just major corporations and small corporations, but all corporations, will effectively eliminate employer-sponsored health care. Employer-funded health care, 30% are getting rid of it. They will continue to offer health care, but it will be an employee-funded or partially funded only. That's a huge, huge number. We know that Walmart, for instance, 2 months ago just eliminated all employer-sponsored health care for part-time employees and cut the full-time to half. That's a significant domino by the largest retailer, one of the largest employers in the world. Your health care costs and insurance premiums are out of control currently, and they're unaffordable for many. Easy, timely, and affordable access to quality primary care physicians is sporadic at best, even for simple flu and sinus symptoms. I want to speak to this for just a second. Primary care physicians. We are 45,000 too short currently to serve the populace that we have in this country. We're short 45,000 primary care physicians. And there's another dynamic or two that you need to know about. Those primary care physicians that are in their late 40s to, say, early 50s, they are looking right now to get out of their care. Many are looking to get out of their businesses while they still can sell them and get something for them. Many of them, and talk to someone, so you don't think that we're just bringing this out from a scare factor, but talk to many of them. They're so frustrated with the inability to be able to service their patients because of the way that they are forced and regulated and mandated by insurance companies to serve their patients. This is a big, big issue. And then you've got a subset that are in their 35 to, say, late 40s that have to continue on. They've created a great business. However, many of them are working harder and more hours than they've ever worked for far, far less money. And there's a silent epidemic of many primary care physicians that are having to file bankruptcy because of their businesses can no longer stay afloat. Thirdly, and just as importantly, you have a youth factor. You have brilliant young minds coming out of school that have spent 4 years of college and 4 or 5 years of medical school and another 4 or 5 years of residency and maybe even another year or two in the specialist element. And they're coming out and they're having $250,000 to $300,000 worth of student loans to pay back. What are the chances of them taking a position as a startup primary care physician and having to earn maybe $75,000 or $85,000 a year starting versus taking a anesthesiologist role or a radiologist role and working a third of the time and making 3 times the money? It's a big dynamic. We have a huge issue with primary care physicians and the availability to them in this country. What's going to happen when we dump 50 million uninsured into the system? Simply put, can't someone figure out a solution for the vast majority of us that simply need affordable and timely access to quality care? Well, someone has, and it's CallMD Plus. Now you have a choice for timely and affordable access to quality care, whether you have insurance or not. I'd like to talk about our products and services right now. CallMD Plus is an affordable avenue to quality health care and services. Please understand, we are not insurance. CallMD Plus is not insurance, and we're not suggesting that you eliminate your insurance. We're simply suggesting that you look at what your insurance does and does not cover. How you negotiate that is up to you. And certainly you need catastrophic insurance at the bare minimum so that you have access to quality care physicians in hospitalizations and emergency situations. We are a concierge telemedicine service with an outstanding medical service and prescription discount program. Our registered nurses and board-certified physicians are on call 24/7, 365. We have over 800 in our system. We offer 3 plans to serve your needs. The CallMD Basic Plan starts affordably priced at $19.95 per month for the entire household. That's you, your spouse, or your significant other, your children that are living with you, or if your children are away at college and they're still a dependent, they're covered in whatever state or city they're living in. It also covers if you have an elderly family relative living with you for palliative care. There are no pre-existing conditions to be concerned about because this is not insurance. There is no waiting period. It is not insurance. You have access the minute that you sign up for your membership. We grant you access 24/7, 365 to our registered nurse hotline. You'll be able to call as often as you like, free of charge, with all types of triage questions. Moreover, when you come on as a member, within 14 days, you will be contacted by our customer service department for a well care visit. During this well care call, we will take all medical information of you, your spouse, your children, everyone that's in your household. We will take all your past medical records just like you would have to do if you went to a walk-in clinic or a primary care and fill it out. Except we keep it in electronic medical records and we store it in a HIPAA-compliant file for use and release by you to whomever you choose and only by you. This HIPAA-compliant file is FileMD, the link of medical and legal data, and for all future use by your approved physicians. If you call the registered nurse line and you have a cold or a flu symptom, or if you have a sinus infection, or if you have a rash, or if you have lost your inhalant and you have COPD and you need an emergency prescription refill, or if you're diabetic and you had your medication and your baggage and you flew to San Francisco from Texas, and however you made it to San Francisco but your bags didn't. If you have a primary care physician in Texas, they can't give you a prescription unless they're board certified in California for that visit that you're going to be in San Francisco. So you may need to talk to a board certified physician if you're definitely sick and the registered nurse suggests that you do. You will have that opportunity for a consultation fee of $35. That'll be cash prior to the conversation. This is about the average of a copay if you have good insurance to your primary care physician. It's also less than a third of what you would pay if you went to a walk-in clinic. and it's, my goodness, probably 20 times less than what you're going to pay if you go to an emergency room. The board-certified physician is going to get on the phone. He's going to answer your questions for you. Let's say you might have a sinus infection. He will prescribe you your Z-Pak or your amoxicillin along with your possible decongestant at a local pharmacy near you. There's over 60,000 pharmacies that take our RX Scripts card. This is included in your basic membership. I will share with you that we have discounts that are deeper than 60%, but we tell you between 20 and 60%. And most of our discounts on prescriptions, if you take any current medications, you should go to our website and look at the prescription finder and fill out your quick information on your prescription that you're looking to fill and see for yourself the discount that you will receive with our prescription card. So for the basic plan, $19.95 a month, 24/7 access, 365 to registered nurses and board-certified physicians. You have quality of care, you have access of care, and you have a price that everyone can afford. The next plan takes the RX Scripts card and the basic plan that we just talked about. We call this the Ultimate Plan, and for $49.90 for your entire household, you will receive all the elements that we talked about in the basic plan, plus we will give you access to Optum Health Allies. This is a United Health Group sponsored product. It gives you access to over 500,000 health professionals within the United States, and these are professionals that have every access covered in specialty, whether it's medical care, dental, vision, infertility treatment, behavioral sciences. There's wellness opportunities for discounts to Jenny Craig, to Nutrisystems. If you're trying to stay well and working out in a gym, there are gym memberships with Gold and Bally and Life Fitness. There's access to alternative care physicians with acupuncture, massage therapy, chiropractic. There's a discount structure of anywhere between 15 and 35% on all of these professionals. And if you use these services, you will also have the opportunity to call the Optum Health Allies line with our registered nurses, allow them to assist you in getting the information to, let's say, an orthopedic surgeon that you need to see. They are now the referral service. You don't need to go to your primary care and get a referral. You don't need to spend that extra money. And let's say that you had a problem with a knee. You hurt your knee playing tennis. You know it's swollen. You know that it's not broken. However, you believe that you've blown your knee out. Your options, if you have insurance, are to call your primary care, go to the primary care whenever he can see you, have a radiologist do your x-ray so he can tell you it's not broken. You pay your primary care his fee. You pay the radiologist their fee. It might be $400 for that x-ray. And if you have an average deductible of $3,000, you pay that $400, not your insurance company. They will then give you a prescription for an MRI because they don't have that equipment, and they will suggest or refer you to an orthopedic surgeon. You will go to that orthopedic surgeon when you can get in. You will pay his fee up front, and you will pay probably $1,250 to $1,300 for that MRI for your knee. Again, if you have a $3,000 deductible, where does that money come from? Yes, the $1,250 goes towards your deductible, but it's also $1,250 extra out of pocket. With our Optum Health Allies, you simply call the 800 number. Our registered nurse answers the call, understands what you've shared with her about your accident. She will in turn assist in getting you to an orthopedic surgeon in your area. She will call that orthopedic surgeon's admin office, make the appointment for you, and share with them that you're there to get an MRI. They will share with them your Optum Health Allies number, and oh, by the way, that pre-negotiated rate for that will be somewhere in the neighborhood of $450 to $500 for the same MRI. Now that comes cash out of pocket too. However, what would you rather spend? The $1,250 or the $450 or $500? Outstanding service, quick access, and affordable. You also receive additional discounts for vision, dental, orthodontia, alternative care, as we mentioned before, behavioral science professionals, health club, fitness, and weight loss memberships, and more. The next piece that we offer, the next plan, is the VIP plan, and for $99 a month, it includes everything that you've seen before for your entire household. Plus now, that $35 doctor consultation goes away. We give you 12 of these consultations annually at no charge. We ask that you use no more than 2 a month, but we're relatively liberal with that, which we wish to keep out chronic abusers of the system. We also offer in this plan ID theft protection. This product is a proactive service, unlike the service that you receive from your LifeLink or your credit bureau. Those products are in the $19.95 to $29.95 or $39.95 range per month, and they're reactive. By that I mean you give these people your information, your credit card, your bank statements, your social security number, and they store it hopefully in a HIPAA-compliant file. I know that LifeLink does. But they store it in a HIPAA-compliant file, and they keep it there until you call them up and say someone has stolen my credit cards or someone has jacked my social security number. Hopefully they also haven't taken money out of your bank account or charged against your cards, because they're reactive. They will stop everything at that point and go to work for you. With our ID theft protection, it's proactive. Once you give us that information, we store it in a HIPAA-compliant file, and now we start cyber searching for anyone using those numbers. So it's a proactive effort. We also offer a reimbursement of one-time element of $25,000 if someone has, in fact, got into your credit cards or your bank account. We also offer discount legal services. This is a group of attorneys that we offer up to 50% off of personal discount legal services. One of the primary products I want to talk about at VIP Plan is Patients Advocacy Protection. This is an outstanding service. What happens with Patients Advocacy Protection? For any one-time medical incident over $2,500, and you either have the inability to pay or you choose to challenge the charges that you're receiving, they go to bat for you and significantly negotiate a reduction in the cost of those bills. Let me give you a quick example. Let's say that you don't have insurance. You double over in pain with your abdomen. You call 911. The ambulance comes, takes you to the hospital. The ER physician checks you in, gets a radiologist over there. They determine that you have appendicitis and it's ready to burst. It needs to come out. They alert the physician on call, the surgeon on call, get you prepped. The anesthesiologist gets in there. The surgeon comes in, makes sure that you're ready to go, takes out your appendix, and then you spend a couple of days in the hospital for recovery. That's about a $30,000 weekend. If you have no insurance, you really have no ability to pay that. That could be a bankruptcy situation. Patients Advocacy at that point, if you have VIP Plan, we would contact Patients Advocacy, the CARES group, on your behalf. We will get all the information from all the bills that you receive, and you will receive a bill from the ambulance, the ER physician, the radiologist, the anesthesiologist, the surgeon that performed the surgery, and the hospital. And if you have no background in medical coding, you have no idea what these services mean, and you're overwhelmed, and what you really should be concerned about is getting rest and recuperating. Patients Advocacy and the CARES group will take over and contact all of those billing entities on your behalf and share with them who they are, what they're doing, and the fact that they need to communicate with them, not you, about your bills. They will successfully negotiate a reduction in cost. Their average reduction is around 70% of the original bill. They will then get back to you and see if you can structure a payment plan that will be beneficial to you to pay for it. Now, if you have no insurance, that's a godsend. Let's say you have insurance and you got a $5,000 deductible. And oh, by the way, you have an 80-20 copay, so 20% of the $25,000 you have to pay, so you're at another $5,000. So you have $10,000 that you have to pay now. What if you are not available to pay that? Or if you really want to challenge the bills because you're not sure of the cost associated with the $250 box of Kleenex that you saw or the $400 Tylenol that you saw. They will come in and negotiate those for you down as well. Tremendous product or service. This by far is our most value for the dollar for any plan that we have and any plan that I've ever seen in the market. I'd like to talk a little bit about our company history. CallMD began in 2006, and we began as an affordable access to discount medical services, and we sold direct businesses and to their employees through the internet direct also as an employer-employee benefit, saving lost sick time, giving them access to quality care that they can afford. Even if you have insurance, does not grant you quality access at the time that you need it. Even if you have a primary care physician, they're not available 24/7. So you need this service whether you have insurance or don't have insurance. We have major unions that have been on board on this. We have over 300,000 members currently with CallMD. The corporate decision was made to market CallMD products and services through a direct sales model through independent associates and retail venues, and we created CallMD Plus 20 months ago. We are now launching this CallMD Plus, and this is the social commerce side of our business. We believe that we truly can triple our membership in the span of the next 12 months. Our CallMD Plus founders contacted Mr. Roland Hansen. Mr. Hansen, if you don't know that name, please Google him. I'm going to give you a little bit of information on Roland right now. To become a board member, Roland Hansen served as Vice President of Worldwide Marketing for Neutrogena Corporation back when Neutrogena was about $11 million a year. He was on board with them to the time that they became around $320 million and negotiated the Johnson & Johnson acquisition of Neutrogena. He was contacted personally by Bill Gates back in 1982. Bill Gates had very few employees. Steve Ballmer was one of them. To come on board as their President of Corporate Communications and Marketing, Worldwide Marketing Director at Microsoft. He acquiesced. He came on board. Roland is the gentleman that branded the GUI interface system known as Windows. He also spent the next 9 years running across the world branding Microsoft and Windows. As you can understand, after that, the saying goes, the rest is history. Roland decided to leave Microsoft on excellent terms. He still sits on the board of directors for Bill and Melinda Gates Foundation. He is still on the board of directors for the Microsoft Alumni Association. His business development consultant and branding consultant company, he also did work with the Nautilus Group, developer of such brands as Bowflex and Nautilus and Schwinn. He allowed and pulled that company together to bring it to over $1 billion. He also was responsible for the syndication of Gary Larson and the Far Side comic strip. He also founded the Be Equal Company, and this is an outstanding company. This mission was to strengthen bonds between children and parents by creating games that made learning fun, interactive family event. He also included partners there, the A&E Channel, History Channel, DreamWorks, Discovery, just to name a few of the companies that he was involved in down here at the bottom. When we contacted Roland, Roland Hansen actually knew one of our founding members, our president, Leonard Soley, and also knew our CEO, Dr. Brian Allard, who's a physician for the Tampa Bay Buccaneers. They had met 4 or 5 years ago in Ixtapa, Mexico, searching and researching for a resort construction that they were looking to be involved in, and Roland was ironically in the same area looking for the same thing. They met, became relatively close. Roland now lives in Santa Barbara, California, where he's about 2 blocks away from where his grandchildren go to school. He actually walks his grandson to and from school daily. Just a little bit about his background. He became fast friends with Leonard Soley. When Leonard presented him the CallMD Plus product and wanted him to be on the board of directors, he said, "Let me do my due diligence," and he did. And he looked at the services and the products, and he came back to us and he said, "I have good news and bad news." He said, "The bad news is I do not want to be on your board of directors." And we said, "Okay, what's the good news?" He said, "Well, I would like to be chairman of your board of directors, and I want to forego any fees that I normally charge. I would simply like a small percentage of the company." He said, "Please understand, gentlemen, I can do pretty much anything that I want in business, and I have many opportunities daily that will significantly garner a lot of revenue. I do not choose who I wish to work with today because of revenue. I choose to work with those people only that can favorably impact humanity or favorably impact America, and this company can do both, and I want to be a part of it." We hired also Mr. Rod Cook, who was a creator of multiple successful commission plans in the social commerce world, to assist us in a dynamic and rewarding commission plan for our associates, for our home-based business side. Mr. Gerald Nera is our chief legal counsel. He was the chief legal counsel for Amway International for 14 years during all of Amway's FTC battles. He was brought on to make sure that everything that we did was compliant in all 50 states. Our ownership and senior management team was identified, and we reviewed many successful direct sales companies, and we created a successful tools and programs for CallMD Plus without the negatives associated with most of these companies. All details were accumulated and put into a long-term successful business plan for our associates and our company, and blessed by Mr. Hansen as we went forward. We are a well-organized company, and we're blessed to be debt-free. And we're very excited about our opportunities for the future. And at CallMD Plus, we do understand that there are keys to success for all businesses, and they're especially true for home-based businesses. Those keys are relatively simple for all businesses. You need to research the industry that you're interested in. Understand, is the industry growing, stagnant, or declining? In our industry, it's certainly growing at a rapid rate. You need to select the company. Is it a proven track record? Does it have dedicated leadership? Is it financially strong? What are the products and services? They need to understand you need a simple but lucrative commissioning structure designed to reward your associates. And you need quality tools so that your processes can be easily duplicable. And you need adequate profit margins to sustain company and associates and control product and production costs. We have all of those things at Column D+. And most importantly, we're helping America turn healthcare into wealth care. We want to make sure that we have something that is already here for the masses, that we can serve the masses, and aside from the revenue generation part, the ability to serve everyone in America with a product and service that is giving them affordable access to quality care without crippling them, we think is a significant and most important mission. I'd like to thank you for your time, and I'd like to thank Dr. Day for his platform. If you have any questions, you can go to our website at www.columndplus.com or connect with anyone that might be one of our associates. Our website has all the tools and programs that you can see on there. We would love to answer any questions that you may have. Dr. Day, thank you again.
Well, thank you very, very, very much, Austin. This has been interesting. And the thing that comes to mind, and folks, by the way, you can type in your questions, please, at the top right-hand of your screen. The question that comes to mind, Austin, and this looks almost too good to be true, but after you've gone through the board of directors and the other people who are involved in this someday, there must be something that works, besides you have over 300,000 people on it. But my thought, being a physician, is without seeing a patient, or without diagnosing a patient, the problem, or without being able to examine the person, isn't that almost like a liability issue?
That's a good question. That's a good question, Doctor. Primarily, understand that we're not here to take over somebody's primary care. We're not ready to be their chronic care provider. What we are is providing cross-coverage physicians for emergency, non-life-threatening issues: cold, sinuses, flu, strep throat, viruses, things of that vein. And quite frankly, most walk-in clinics, the doctor is not the one prescribing the medication and not seeing the patient anyway. A nurse practitioner or possibly an RN is seeing them. On most of the issues, if it looks to be something that would go beyond the normal scope of what a physician would be able to stand in front of a board of his peers and say that I prescribed something that was beyond what would be normal of the realm for the situation, that be an issue that any physician, whether they saw you in person or listened to you on the phone or saw you through a video or a Skype, would simply have to deal with. All of our physicians are board certified. They all carry their own liability insurance and malpractice insurance. And no different than going to a walk-in clinic, if you provide information to the RN there that is incomplete, let's say that you have an allergy to penicillin and you don't share that with someone and they prescribe you amoxicillin, that's the same as if they did it over the phone or in person. So their coverage, if you provide your information up front, is no different than going to your primary care physician or to a walk-in clinic, and you're doing it from the comfort of your own home or the desk at your office. You're not having to climb in a car, go down to a clinic, or go down to an emergency room and sit and wait hours upon hours with some very sick people. And again, we're not trying to take over the primary care role. We suggest that you go to your primary care physician if you're having further issue. We also, there are many times, if it seems through the triage questioning, the RN will not bring our cross-care coverage physician on the phone. She will suggest that you go immediately to an emergency room. It just depends upon the situation.
Interesting. So there are internal controls to make sure that everything is done right.
Absolutely.
Wow, impressive. What if I'm traveling, and I think you covered this to an extent, what if I'm traveling and I've run out of my statin drugs, for instance, and I need a refill? How can this help me?
This can help you tremendously. Let's say that you are, where are you from, Dr. Dave?
Tulsa, Oklahoma.
You're in Tulsa, Oklahoma, and you're traveling to Pittsburgh, Pennsylvania. And if you're, the fact that you're a physician can certainly change things, but if you're a normal citizen and you go to Pittsburgh and you left your statins at home and you're going to be in Pittsburgh for, say, a week, you can call the 800 number, share with them, and they will have, by the way, your medical history already on file. They will understand that you have a cholesterol issue, that you have been taking statins, and that you have foregone or forgotten, or the bag was lost with your medication. Here's classically how they will work to get you immediate care. First off, you can't call your primary care physician back in Tulsa. Unless they're board certified in Pennsylvania, you can't get a prescription call then. You're going to have to go to a walk-in clinic or emergency room. Or you call CallMD Plus. CallMD Plus reviews your background, reviews the fact that you do have statins, simvastatin possibly as a medication, and they will ask you, David, how long do you plan on being in Pittsburgh? Well, I'm going to be here a week. Here's what we're going to do. We suggest you call your primary care so that you can have an appointment on your way back, on your way home, or when you get home. But we're going to give you a prescription for 10 days for your simvastatin that will get you through your visit and 3 days surplus for you to get back home. That would be a normal opportunity on a product or service that we know you need. Could be the same thing if you had a COPD inhaler, that you know you need it and you need it now. Maybe you forgot your insulin. They're going to know because that's on your medical records that we store and keep.
What's your relationship with big pharmacies, Walgreens, CVS?
Well, our RX prescription card is accepted by over 60,000 pharmacies in the country. Every major pharmacy that you could probably name, and most of the small pharmacies that you wouldn't know unless you were in that city, take our prescription discount card.
Wow, so pretty much any Walgreens, CVS,
Walgreens, CVS, Walmart, most grocery stores that have pharmacies. My goodness, the list is, again, 60,000 strong. It would take a while to walk through those for you.
Wow, impressive. What do you think Roland, the chairman of the board, saw about this that made it so impressive to him?
Well, when we first presented it to him, he looked at Leonard and he said, "You're talking about concierge telemedicine." He said, "I have a concierge doctor for my family and I. It cost me $15,000 a year for him to be on call 24/7 for my family and I." He said, "You're telling me that I can get a board-certified physician on the phone 24/7, 365 for $19 a month?" And we said, "Yes, we are." And I asked him, I said, "Roland, with your physician, because he's in Santa Barbara, if you're in New York, he can't call you in a prescription. He can refer you to a physician that can see you or can call you in a prescription. But unless he's board certified in New York, he can't help you." He said, "You're right." So when he looked at this, he knows about the ills of healthcare. He knows how it's crippling companies. He knows how it's crippling individuals in this country. And he also is aware that for under $20 a month, just to have access and the ability to have access at a $35 consultation fee and be able to get a prescription at a significant discount over retail is a staggering advantage to the average American. And again, his mission for helping companies grow right now, or choosing companies which one he's going to help grow, are very simple. Do they favorably impact America or do they favorably impact humanity? This does both.
Your decision to become go the direct sales route through what is known popularly as MLM, what informed that decision?
We looked at a lot of different things, Dr. Dave. I came, again, from a traditional business background. When you're looking to impact the market and you're a 6-year-old company and you have a significant number of membership already, what is the cost of acquisition of your current client moving forward? We could go spend $30 million for a few Super Bowl ads like GoDaddy.com and have some immediate impact. I'm not so sure how effective it would be, but we could do that. When you look at the ability to garner ongoing residual income and the ability to garner market share, there is no better, faster way than by independent associates with word of mouth that understand how to spread an effective message. It's all about us to make sure that the message is proper, consistent, and taught correctly so that you can train the trainer. And I've been in a lot of different businesses, and I can share with you the ones that have been most successful were the ones that had independent associates. Even in some traditional channels of distribution I had, independent associates made the business fly quicker at a cost that was geared on commissions. So you tied it in, so your cost of overhead was significantly lower, and your profit at the end of the day was better as a company if you rewarded your associates favorably. Ask Warren Buffett with Pampered Chef the same question.
Right. It seems like a growing number of businesses are taking that route, even in areas that you would not expect. So,
if I may add to that just briefly, there's a lot of connotations about MLM or network marketing. The things I'd like to share with you that you will not see or hear from our company are pretty significant. You may or may not know some of these following companies that market with a multi-tiered commission structure. Keller Williams Real Estate.
Okay.
Jack Canfield Life Coaching. Jack Canfield, Chicken Soup for the Soul. Primerica Financial Services from Chase Manhattan. These are companies that are incredibly effective, and they all have a commission structure based on associate recruitment and multi-level commissioning or overrides. They don't have to all be the in-your-face, raining dollars from the ceiling, showing people with yachts and Learjets. That's not who we are. We believe we have an outstanding product and service that will assist the masses, and we believe that we have an associate program that can assist anybody, whether they're looking to work 2 or 3 hours a week or 50 hours a week, to earn a significant income by sharing this product or service that we're so proud of.
So I know you do have a very elaborate, but I believe straightforward plan for people to generate revenue. So basically, people can earn not just a token income, but a significant revenue from sharing this with other people. Is that what you're saying?
To us, significant has different meanings to all of us. For instance, to someone that's highly successful, something in the high 6 or 7 figure a year income is significant. Quite frankly, to many people that are struggling in this country, an extra $1,200 to $2,000 a month is significant. So we want to share with you that we do have a very simple plan. It is geared for any of those people at any walk of life, whether you're looking to earn an additional $1,200 to $2,000 a month and assist in paying your mortgage and your car payment, or your current financial situation, or if you understand how to build an organization and are looking to earn significant 6 to 7 figure a year income. We have that plan for you. We have 3 different ways to generate revenue. We have ways to generate revenue by selling this product direct to businesses for the employer-employee benefit, and never build an organization. It's the only product I've ever seen in a social commerce or networking company that you can actually do that with and go to any business in this country, because when you mention healthcare to any employer, you're going to get the HR director's ear. It is one of the single biggest issues. Let me throw a couple out here for you that the names come across. I'm sure everyone's familiar with Hostess Bakery, 60-year-old company plus in this country, the makers of Wonder Bread and Twinkies, filed bankruptcy 30 days ago. They cited as one of their biggest problems the ongoing cost of providing benefits, medical benefits, to current employees and past employees as their single number one reason. Number one reason that they had to They had to file Chapter 11 for reorganization.
Oh, wow.
Healthcare is not only crippling Americans, but it's crippling corporations. The Walmart I just cited earlier, that decision made was billions of dollars to Walmart's bottom line. We're going to see a lot of that. Now, we also see roughly 10% unemployment that the country admits to. It's clearly more than that, but it's an average of 10%. Well, what are these people doing right now in the worst economic conditions that we've had in this history of this country since the Great Depression? What are we doing to better ourselves? If we don't make a decision to change what we currently do, we're destined to repeat it. Change has a tendency to frighten people. I have found that when the level of pain that I currently exist in my current situation exceeds my fear of change, that's when I make a change. I think that's pretty true for most people.
Right. Do you have training for people to approach organizations? Let's say they become business people and they want to approach organizations. Do you have a support base in store for them?
Yes, we do. We have electronic webinar training. We have conference call training. We have personal training depending upon what city they're in as we roll these out. We have 5-hour sessions, 8-hour sessions, and 2-day 8-hour sessions each of training that will enable our new associates to understand exactly what they have their hands around, that they are not insurance agents, that they are Call and B+ associates, and what they provide and what they don't provide, and how a benefit it is to employers and employees. We also have a nonprofit program for 501c organizations that enables them up to 25% of the residual income off of our plans, because they're monthly plans, that allows them to generate funds and fundraising opportunities ongoing residually every year, as opposed to creating one-off events for the 501c, whether it's a golf outing or a gala or a silent auction or whatever it might be for the church or United Way or women's centers, whatever that passion may be that you have, the cancer prevention, pediatric associations, whatever that 501c3 that you're passionate about, they have a couple of things that they're trying to share with you. One, be passionate about our cause. Number two, help us raise funds so that we can all remain passionate about our cause. We give them an opportunity to have a product and service that they can sell and earn 25% of the proceeds for their cause residually forever.
Well, I think we need to have you come on to next time, hopefully soon. My understanding was that there was a promotion that's going on, ending very shortly. Is that true? The discounts you're giving out?
There's a promotion going on as we're rolling this portion of our business out. That at the end of February, at the 1st of February, changes. It doesn't end; it just changes. And we have significant promotional opportunities through February and March to not only become a member and utilize our products and services, but to understand how to become an associate for as little as $50 and be able to promote this product and earn a residual income. So there's some significant opportunities to have a franchise without a franchise fee, make your own hours, whether it's 2 hours or 52 hours a week you wish to work, and earn basically the level of income that you wish, and help facilitate the need that most every person in America has of accessible, cost-effective health care.
Fantastic. Well, Austin, if it's okay with you, we would certainly love to have you come back and talk about this other aspect, because I think it's so important for people to be able to have access to home-based business that they can use to help other people. And apparently this is it seems easy. Everybody understands the value. You don't have to sit down and explain to them in detail how this works on the brain or how this works in the body. It's something that is
exactly
intuitive. People understand the value. Yeah. So if it's okay with you, we would love to have you come back soon and really explain how this thing works.
I would relish the opportunity, Dr. Dave, if you just you give me the time in advance, and I would be more than happy to come back on.
Okay. Very much appreciated, Austin. Any final words you want to leave us with?
I just, again, thank you so very much for allowing us to share with passion what our mission is. And these products and services we're very proud to offer, and we're very proud to bring people into our organization and train them so that they too can present this service to the vast majority. We would really like to have 10% of the population of this country in the next few years being well taken care of and well prepared to take control of their own health care.
That would be a good thing. That would really be a good thing. All right. Well, thank you, sir. And
thank you, Dave.
Much appreciated. And I want to say a special thank you again to Helen and Danny's son, both of whom are board-certified physicians, who came across this wonderful resource, a wonderful organization, and they wanted us to be able to share this with the rest of the world. And we will make this recording available to our thousands of viewers around the country and around the world so they can watch it, and we'll certainly look forward to a big turnout for Mr. Austin's next presentation. Folks, thank you for joining us. God bless. Have a great evening.
God bless you. Thank you, Dr. Dave.